Siegel brothers. Dr. Ricky Siegel is a certified sex therapist, educator, and supervisor, and his brother Larry Siegel is a clinical sexologist and certified sexuality educator. The Siegel brothers are here to answer all your questions about sex and sexuality, but we're unsure who to ask, including questions you didn't even know you had. They will also welcome guests from around the globe to talk about a wide variety of topics and issues within the fascinating world of sexuality. Thank you for joining us, and welcome to Sex Talk.
It's cool being together.
Good evening. It's Monday at 9. That means it's time for Sex Talk with the Siegel brothers. My name is Dr. Richard Siegel. I'm a certified sex therapist.
And I'm Larry Siegel, a clinical sexologist and certified sexuality educator.
And my awesome big brother.
Proud to be.
And we're really happy tonight to be joined by our special guest, Dr. Michelle Weiner.
Thank you for having me.
It's really good to meet you, and through a mutual friend that we all adore. And if you're listening or watching, Shemaya, we're sending love. We are on the radio in South Florida on 95.3 FM and 1470 AM, or streaming live on Facebook. If you're watching on Facebook, hello.
Hey.
Thank you for joining us. Please hit that like and share button and help us spread the word. And jot down this number, 888-565-1470, to call in and join the conversation, ask any questions of us or Dr. Weiner.
And if you are watching on Facebook, you can just submit a question via that. Hit the submit question button, and you're good to go.
Wonderful. So, our topic tonight is cannabis and sexuality.
Mm-hmm.
And, well, first, why don't we start with telling us a little bit about your background and specialty in medicine and how you arrived at this particular specialty.
Mm-hmm.
So I did physical medicine and rehab for my residency, and I did an interventional pain fellowship. And I've been in private practice for about 6 years now, practicing pain management, and I found that too many of my patients were suffering with chronic pain and on opioids. And so when medical marijuana became legal 2 years ago, I use it as an alternative to help wean them off of opioids and just give them a better quality of life. And so I'm currently faculty at FIU, and we're doing research with my patient population who are on opioids, and we have about 130 patients right now that are in the process of weaning off opioids by using CBD and cannabis.
Wow.
Mm-hmm.
Yeah.
And along the way, we find how it's really treating anxiety, insomnia, depression, and many other symptoms that go along with chronic pain.
Mm-hmm.
So I've been using cannabis for about 2 years with the patients, and now I use it to treat pretty much everything in Florida. A lot of neurological issues, not just pain, cancer, obviously, and then some typical anxiety, insomnia that a lot of people have.
Sure.
So it's really changed my practice. It's changed my algorithm for how I treat chronic pain patients. And really, my job is much more satisfying to myself, because I actually find like the patients are coming back stating that they just feel better. You know, they feel younger, they have more energy.
As if we needed any convincing beforehand, because obviously we've been advocates for the better part of 30 years. But ultimately, nothing had the impact of your dog, the late and wonderful Sage, who was just the best dog ever, whose quality of life in the last couple of years, and just an improvement that you can
seizure
see, and obviously can't claim any placebo effect because it's a dog.
Right.
Assume they think they're high. It's a dog. When you see a dog able to run across the room and jump up on the bed, where 2 weeks prior she was unable to do that, it's pretty hard to argue with the effect.
Yeah, I mean that's and she has sold me on two things that I think are out there, and we should be using more of, both the cannabis and acupuncture. Right. And again, if you're seeing the effectiveness in an animal, there is no placebo, there is no expectation. It's real.
Right. I think that whole mind-body connection is a really big. It's right now it's a very popular concept, but it really makes a lot of sense when you're using cannabis and even acupuncture, because you're using one medication that's working on the mind and all parts of the body, and we have a lot of research about the endocannabinoid system and how this really has to do with multiple systems in our body, all different organs. So using, and even for sex. I mean, just in terms of using cannabis for the relaxation in terms of your mind, or actually enhancing pleasure in the body. So I think that acupuncture and cannabis and a lot of these other holistic treatments are going to become more and more popular as we're seeing patients getting better as opposed to using pharmaceuticals.
Absolutely.
It's so, and of course, the timing couldn't be more perfect for both chronic pain and sexual dysfunction, which most of the time is rooted in anxiety.
Right. Exactly.
Of course, we know there's the small population of patients for whom marijuana causes anxiety.
Right.
So that's not going to be the best choice of medicine.
But then that's why we have to
There's also
educate.
workarounds with that as well.
Right, because a lot of that anxiety is caused from high amounts of THC without CBD added to it. So a lot of people can benefit just from CBD or a combination of the two in certain ratios, or the way that they're consuming it, or the milligrams. So the people who actually shy away from cannabis because they've had a bad experience, it's important even to educate
there's
them.
that expectation again, the
Right.
anticipation.
Well, exactly. But again, that's where education comes in as well, because that's more likely to happen with probably some sativas than indicas, which, because they do have a greater autonomic versus the central effect.
Right.
And again, there's workarounds, there's different kinds of combinations, and again, adding the CBD and learning how to balance that a little bit more. I mean, it's so young, and that's the thing. It's really so young. It's been something that people have been talking about peripherally for many years. I mean, truly centuries.
Right.
And in the last 40, 50 years, there's so much that has been trying to be done that we could. I mean, some of us, especially that are older. It's kind of a mind-boggling place to be.
Right.
Thinking in the 70s if we'd ever be in this, but first of all, on the radio talking about legitimate medical treatment with cannabis.
But it took a little while to discover the endocannabinoid system, to understand the medical
we
benefits
both came
of
out of
it.
drug and brain research, and I did my undergraduate in pharmacy school, and Larry studied neuropharmacology and neuropsych. And even then, it was like, what, is it, you're building some receptors? Where's the endogenous molecule? It was just a whole
And we've known
frontier.
from the late 80s and early 90s about the anandamide and the 2AG receptors, and those which, if it was going to go sort of neuroscience geek, I would have a little discussion about,
We can do
are
that.
those the ligands, or really are the cannabinoids the ligands? Because you're talking about this natural system, and we've come to see that in virtually every sensory system, as a matter of fact, every homeostatic system is loaded with endocannabinoids.
Right.
And that's sort of the main
And
function.
cannabinoid receptors.
Yeah. And again, to me, that's really where it's less the chemicals than the receptor activity.
Right.
And that we have those receptors.
And they're doing research on things like estrogen levels and cannabinoid receptors.
absolutely.
Wow.
Or how anandamide levels may decrease over time. Our endogenous cannabinoid levels may decrease over time, similar to even, let's say, estrogen in a postmenopausal woman, how cannabis could be used to help with some of their symptoms. And so it's funny because I'll treat a patient with pain and they'll tell me, well, my hot flashes have improved, or less anxiety. So they're getting these benefits, and you have to understand it could also be affecting estrogen levels or the
And
endocannabinoid.
actually vice versa.
Right, exactly. Or increasing endogenous cannabinoid levels.
Yeah. And let's if we can, I want to
Wait, let me just
look at that.
Quick,
We have a
say that caller, please call back in.
Oh, sorry. Because that's another really fascinating area that some of the animal studies have shown, that there is this sort of difference in how THC in particular affects women's brains versus men's brains, and that effect of estradiol and that interaction with cannabinoids.
There was an animal study done where female rats would push the lever more often than male rats for a drug that activated the CB1 receptors, and those receptors are found in the reward stimulating parts of the brain, like the amygdala. So they were basically saying that perhaps women or female, may actually have more of an effect on THC or be more sensitive to THC because the THC binds to the CB1 receptors.
Right, and evidence to show that when estrogen levels are high, sensitivity
Right.
and impact of THC stimulation
use.
is greater.
Right.
And talk about a risk to benefit ratio. Show me a more perfect, spot on harm reduction strategy for treating addiction
Right.
than this white knuckling abstinence, mental illness causing, anxiety disorder causing approach to
Right.
recovery that we
Not
use.
only are you actually treating the mind, right, with it, in terms of addiction, but you're actually decreasing withdrawal symptoms because cannabis can really be used for that restlessness, the agitation, the insomnia. So, I mean, it really is
All of it.
effective if they're able to stick with it.
Right,
And the problem,
of course.
again, is cost, usually.
Yes.
Okay.
Oh, okay, we do have a call.
Our caller is back. Is it a mystery
guys.
guest? Hello.
Hear me? This is Shemaya.
Hello, love.
Hello, it's so wonderful to hear you guys and hear you too as well, Dr. Weiner. I just wanted to give you guys kudos and say this is just amazing, and I'm so glad that it's actually come to this and this fruition, and I just want to wish you guys great luck, and you're doing a really good job out there, so I really appreciate you. And I can tell you as a patient of Dr. Weiner's, it's amazing. My quality of life is so much better since I've become a patient, and I don't have to have surgery, and I'm walking, and everything's fantastic. So thank you guys a lot.
Thank you.
We love
We
and
adore
miss
you.
you, Shemaya. We hope we can hook up soon.
Oh, we will. We
Yes,
will.
definitely.
Thanks for calling,
Thank you,
love.
Shemaya.
Thanks.
You're welcome, guys. Take care.
You as well. So and this use of cannabis and the connections that we're seeing to, especially for female, sexual response, erotic perception,
Right.
orgasmic enjoyment, all of these things we're seeing. And granted, a lot of it anecdotal right now, but we're really seeing these consistent trend in reporting that it's all good.
Right, and
Yeah,
there
it really
are
is.
some studies actually, and it really is showing increase in pleasure, satisfaction. But I think it's also dispelling those myths that cannabis makes you lazy and there's a lot of
Amotivational
right,
syndrome.
exactly, and so it actually can increase sexual performance, and that's where some of the strains come into play. So picking something that can actually give you more energy or make you more in your body than your mind, you can be a
Or
little
just
bit more selective.
disinhibited enough
Right.
to be more present.
Right.
And we always, sex therapists always talk about the spectatoring that causes most sexual dysfunction.
Right.
Now, do you find that there are maybe any potential pitfalls or issues that would be maybe more unique to women using cannabis, particularly for, let's say, sexual medicine compared to men?
Well, I think it's really controlling the anxiety. So I think picking the right strain is important, or using CBD. And I think that a lot of people are looking more just at the THC, and they're forgetting that the CBD molecule can take away some of that anxiety and just relax them and not cause the intoxicating effects. So I think women may be a little bit more sensitive to, based on maybe estrogen levels, to actually getting some anxiety from using THC. So when they're going to do something that they want to relax them so that they can enjoy that moment, it actually may backfire and they may become a little paranoid and anxious. So, whether it's body image or, pelvic pain, whatever they're in their mind about, it may actually inhibit that, which is what we want. But if you're using a sativa or something like that, and that's going to cause a negative side effect, then that's where the education comes into play. I think it's also timing. So knowing what route of administration to use is really important, right? So if they're going to use a capsule and then have sex in 10 minutes, well, that's not going to kick in for like an hour, right? Or, vaping may only last a short amount of time, and depending on, what their activities are or for how long, that can also affect that as well. So there's just a lot of educating that has to happen. I find like my patients who are mainly sick, right, either pain or neurological issues, they're basically coming to me saying, I'm using cannabis for one reason, but now it's actually making me more adventurous or, a little bit disinhibited. And I've been doing some things that I never thought of, for one, using cannabis, right? And then now I'm actually willing to do some other activities or open my mind to some other things that I never really thought I would do in the past with my partner, open up that conversation.
Yeah, and and it's interesting too how some of the animal research shows how there's that different effect in the different parts of the brain. I guess the brain equivalent of Europe for most Americans, when we talk about the striatum,
Right.
just like people talk about Europe like it's a kind of a continent, or a country unto itself. Again, the striatum, but looking at sort of I guess it's the ventral part that we see more of these endocannabinoid receptors in men. So we see the more of the connection with motivation and reward,
Right.
as opposed to the dorsal populations that we see in women of those receptors, which are more connected to like association and some of the sensory motor issues. Do you find, because I know there have been some interpretations of that show that women that are being treated with cannabis, because of that difference in brain regions, might be more prone to develop symptoms of maybe like a cannabis use disorder than men?
Well, that's interesting. The cannabis use disorder.
Because also the anxiety reduction, that's more of that behavior for women.
Right.
Throw that in.
And so I think it's a lot of times how often they can use it, and if it's appropriate. The cannabis use disorder, it is a true disorder. However, it's not, to me, an addiction, right? And in terms of using cannabis, there's not a real withdrawal type of effect. It's probably like the same as coffee, So I think that it comes down to most of my patients are using it responsibly for medical conditions, and I don't find a lot of people. But there are, cannabis use disorder is a real disorder, and I think that it's going to be an issue because medical marijuana is so much more accepted these days, and so people are going to start using it at a young age. They're going to nowadays they have up to 85-90% THC concentrate, so they're going to be saturating their cannabinoid receptors. It's going to be harder and harder.
That's a whole different ballgame. Yeah.
Right.
That's definitely a whole different ballgame.
Shatter and wax.
Right,
And, all of these
and so they're
products.
going to start getting used to these things having less of an effect from what is the typical marijuana, and kind of always trying to achieve that. But I think it's really the person. I don't know. I think that I've seen it, both for men and women in terms of cannabis use disorder, but it's really about educating. When someone's using it too often or too high of a percentage of THC, I educate them about the CBD and about using it as a longer acting form as opposed to ups and downs, right? So those peaks and valleys are what I think gets them in trouble a lot of times. And so we
Especially
kind of
someone hypersensitive to their mood and feeling unable to regulate it.
right. But it's amazing how many routes of administration there are. So
I wanted to ask you about some of that too, like some of the topicals.
Yeah, historically, there's always been an issue for physicians to say smoke, even if someone's dying, because smoking is not healthful.
right.
Right.
But if you could say have a lollipop,
Right.
right, it certainly makes it
Right,
easier.
and so the thing about smoking is that flower really it has the most medicinal benefits because of the entourage effect, because all of the cannabinoids and the terpenes and flavonoids. So there is a benefit to using flower. Hopefully they could vape it, right?
Vaporizing instead of smoking.
Right,
Yeah.
and then obviously tinctures and capsules and edibles. If you want something to last a little bit longer, but the topical is a big thing in terms of the pain relief, or let's say a skin type of issue. So that's very common. There's transdermal patches also that have systemic effects, but I think that now we get into lubricants as well. And so there's a company called Foria. You know Foria?
Yeah, I've heard of them. Uh-huh.
So
I have not.
they have a researcher from Harvard that is doing a study on 400 women, and they're looking at using their lubricant that has CBD in it for menstrual symptoms and
gonna ask
pain
about
and
that
things
too.
like that. So they're actually starting to do some research, but it's interesting because are the cannabinoid receptors in the vagina, or the cannabinoid receptors, throughout or for males, like what's going to be the future, right? So I think with the lubricant, a lot is it the placebo effect, and then also the time until you're feeling any type of increased sensation, increased blood flow,
Of course, there's a 12-year-old that lives in here that thinks, getting the kiddie stoned used to involve eustachian tubes. Yeah, it's
but it's really it's a way to not get intoxicated or not feel high.
And have that local effect.
Right, and it could be great for pain. I mean, I know they have suppositories in the dispensaries, and I have a ton of patients with pelvic pain or even pelvic or colon cancers that are using suppositories, and there is much less of that intoxicating effect because of the passageway and the amount of time it will take to get to the brain. So for some of the cancer patients who need high amounts of THC, they use suppositories. And then for the other thought process is put the medicine where the problem is, right? So
I know they've been using gynecologists sometimes use Valium suppositories.
right,
Yeah.
exactly.
Yeah.
Same purpose.
Absolutely. And is there also truth to the notion that, especially with some of the topicals and the locals, that even with women that have had hysterectomies, with just the local effect increasing just lubrication, decreasing inflammation, that in itself can increase the subjective experience of arousal.
Right. I think the issue really is that it's not studied how long until effect, right? So how are we going to figure out, because how do we figure out how long that patient would actually feel the benefit of it? But it's going to be difficult because of the subjective results. Everything's going to be anecdotal. So doing good research, again, it's that whole benefit risk. We're not offering something that's going to have much risk. So the standards may be different. You don't need a double-blind, placebo-controlled, randomized trial, right?
Yeah.
But that's what we all like to see.
When Andrew Weil did some of the first marijuana studies in 69, 70, his biggest obstacle, and took 6 months to start getting into it, was getting a control group.
Right.
That was
couldn't find
naive.
a dozen
Right, of
students
course.
that had never
That's
smoked
funny.
pot before. We have Stephanie on the phone, and we have a
Stephanie,
Facebook question
hello.
we'll get to in a minute. Hi, Stephanie.
Hey, how
Hey.
you doing?
Hey, how are you?
Good. I have a question. Sort of a common question. We did a trip out in Colorado a couple of years ago, and for the first time, I tried edibles, and I was having, and I had been having problems being sexually excited, really wasn't interested in sex, super low libido, but wow, did those edibles change that big time.
Good.
I had never had such intense orgasms from when I was on edibles. So I was just kind of wondering, why did it actually feel physically different to me? And are edibles, it seems like it feels more sexual to me when I'm on edibles more than actually smoking cannabis or anything like that. Is it just the type of cannabis it is, or does it affect you differently when you eat it versus
Yes.
other
Yeah.
ones?
So the THC molecule, the psychoactive molecule, is converted from delta 9 to delta 11 in the liver, and it's 5 times as potent when you eat it. So
And it
usually,
also tends to sneak up on you.
yeah. So usually, and it takes a little while,
Somebody
which
goes,
is
"That's
why
2 hours
people
later,
get
I don't feel
impatient.
anything, give me another one."
Right.
So that's why a lot of people's first experiences with marijuana these days are with edibles, and they get too high, or they really feel a very intoxicating effect from it. And also it depends what's in the edible. So you don't really know the percentage of THC or the milligrams. What's very common is
It's
usually
hard to
5 or 10
regulate,
milligrams.
yeah.
But yeah, by eating it, it actually converts to a more potent form of THC. So that's why comparing it to a tincture or vaping, you'll probably feel more of that effect.
Okay.
Yeah.
Okay.
And
But why did it
you raise
change my sexual response like that drastically? Like physically, my orgasms were totally different.
As opposed to when you just
Right.
smoke THC, is that what you're saying?
Or as opposed to just a regular, not being
like
high
not
at all.
using cannabis.
Well, that's basically, one of the benefits of using THC is that it can actually increase pleasure, satisfaction, more of like an erotic experience, but also the fact that you were using a higher potency of THC will make that experience more enjoyable. Same thing with using a higher concentrate of THC would do the same. However, maybe it was just like the perfect strain for you. You know, maybe it just happened to be something that suited you well.
Even a lot of therapists are who talk about sexual effects of drugs. There's a bit of fear to talk about pro-sexual effects. People get nervous. It's easy to talk about sexual dysfunction, but drugs with pro-sexual effects, and this age-old thing we've been talking about forever. People say, "Oh, it's not really better. It's just the marijuana." Well, isn't it all about perception?
Right.
A drug does what it does because of our perception to whatever particular physiological function it's changing.
I mean, it's like that ridiculous
Again,
weather
the
standard.
mind-body thing.
Right? If it's 22 degrees, but with the wind chill, it feels like 12. It's 12. That's what it is. If it just seems like it feels better, then it does feel better. I also want to say, too, that we have to keep in mind that none of these chemical systems in our body are straight lines or are linear. So there's also other kinds of effects. Again, with the estrogen, there's likely testosterone effects. There's likely oxytocin effects. There's a dopaminergic effect. There's going to be probably a decrease in serotonin and a number of those other things that we just really haven't identified yet, and still don't even know what the other 100 or so cannabinoids are actually doing in there.
Exactly.
Did you have a Facebook question there?
Yeah, but I think the music is going to start playing. How does cannabis use disorder become a disorder? What classifies it as a usage disorder? You know what, Kat Rose? We'll both answer that back on Facebook when we have some more time. We're going to have you back again to continue the conversation.
Yeah,
it was really great to meet you, and thank you so much for coming in and talking with us. Of course, any questions for Dr. Weiner, again, hit the send email button on our Facebook page at Sex Talk with the Siegel Brothers, and we will forward that question along. Or give us the website again.
It's drmichelleweiner.com, and our number is 305-974-5533.
And you're all over Palm Beach and Broward and Dade.
Yes.
Very good.
Thank you, guys.
Excellent.
And
Thanks so much.
thank you, everyone, for joining us and listening and watching. And join us. We'll be here next Monday and every Monday at 9 for Sex Talk with the Siegel Brothers.
That's it. Have a great week. Thanks, all.
You've been listening to Sex Talk with the Siegel Brothers. Join us every Monday night at 9 p.m. on WNN, 1470 AM and 95.3 FM. Or watch live streaming video at AMP2 TV Productions on Facebook, or look for the shows on YouTube. Thanks for tuning in, and we hope you'll join us again next week. The opinions expressed